The ID that changed everything. In a small suburban town in the USA nestled in the heart of a bustling hospital, there worked a nurse named Carol. Carol had been with the hospital for over 15 years, and while she was known for her expertise and efficiency, she also had a reputation for being a bit cold and distant with patients. Her colleagues often whispered about her subtle biases, though no one dared to confront her directly. One afternoon, a black man, David Carter, walked into the emergency room. With visible discomfort, he looked to be in his mid-30s, tall and well-dressed in a business suit. But his grimace was enough to suggest something more serious. Carol was assigned to assist him, and as usual, she put on her professional mask. "Good afternoon, Mr. Carter. What seems to be the issue?" she asked with a neutral tone, though her gaze seemed to linger a little longer than it should have on his clothes and demeanor. David explained that he had been experiencing severe chest pains and shortness of breath. His eyes were tired, and he seemed anxious. But it was not until he started explaining the pain that Carol felt a sudden twinge of discomfort. She couldn't quite place it, but something about him made her uneasy. Her instinct told her to be cautious, maybe even suspicious. "All right, I'll need to take your ID for the records," she said almost mechanically. David handed her his driver's license without a second thought. But the moment Carol glanced at the ID, her whole demeanor shifted. The color drained from her face, and she froze. David watched as Carol's eyes widened, her fingers trembling. As she held the ID, she stared at it for what felt like an eternity. His name was David Carter. But that wasn't the part that caused her panic. It was the address. The address on his ID was just a few blocks away from the hospital, a wealthy, predominantly white neighborhood that Carol had always been told to avoid. Her mind raced, filled with irrational thoughts. "Mr. Carter," she stammered, Where exactly do you live?" David frowned, confused. "I just told you why." Carol's hand tightened on the clipboard, her knuckles pale. Her voice had shifted into a more dismissive tone. "You must have made a mistake on the form. We have protocols here. You're not from around here, are you?" David's expression hardened. The discomfort from his chest, pain turning into frustration. He knew exactly where this was headed. "I live exactly where my ID says I live, and I need medical attention now. My chest hurts. You can check it if you want, but I need help." Carol hesitated, still glancing between the ID and David. A wave of discomfort rolled over her, but the real reason she hesitated wasn't just about the address. It was about the unspoken, ingrained bias she had never admitted to herself. She had made assumptions about him the moment she saw him, assumptions about his background, his worth, and now his need for care. She had convinced herself that someone from a neighborhood like his couldn't possibly be in real distress, that this might just be some trick, a scam, or a waste of resources. Then something unexpected happened. A senior nurse, Nurse Daniels, walked over and saw the scene unfolding. She had been in the field long enough to know when something wasn't right. "Carol," Nurse Daniels said gently, but firmly, "What's going on?" Carol hesitated, but didn't answer right away. Nurse Daniels looked at David, then back at Carol, and then her expression hardened. "Mr. Carter, I'm so sorry about this. We'll take care of you now. Carol, please step aside." Carol's face flushed, but she didn't speak. The weight of her own silence was enough to convict her. As Nurse Daniels took over the situation, getting David the help he needed, Carol stood off to the side, grappling with the sudden weight of her own internal biases. She had nearly denied a man help because of the assumptions she had made based on his appearance and address. As the hours passed and David received treatment, Carol couldn't stop thinking about the look in his eyes, the hurt and confusion that mirrored something deeper than physical pain. Weeks later, David returned to the hospital for a follow-up. This time, Carol was ready for him. She approached him, her eyes filled with an unexpected sincerity. "Mr. Carter, I want to apologize for how I treated you last time. I misjudged you, and I am truly sorry." David paused, surprised. "I didn't expect an apology, but I appreciate it. We all have our moments, right? But what matters is how we move forward. Carol nodded, humbled. She was beginning to understand that prejudice wasn't always visible, but it was real. The encounter had shaken her more than she was willing to admit, but in a strange way, it had also opened her eyes to her own flaws. And for the first time in her life, she understood the true meaning of empathy, not just as a nurse, but as a human being. David left the hospital that day, no longer just a patient to Carol. He was a reminder that the world often works in mysterious ways, and sometimes even the smallest actions can change the course of someone's life. Carol's small moment of self-reflection would be a turning point, not just for her career, but for her as a person. And for David, it was another story to tell of how the man who nearly denied him care because of the color of his skin ended up being the one who learned the most from their encounter.